Hello everyone, so let me just check, am I audible, is the screen clear so that we can start the session. This is Cadaveric Image MCQs Session first part, conquering the NEET PG 2022 examination. So in this session, I am going to discuss MCQ related to the image based anatomy MCQs, which is very useful for your not only NEET PG 2022 exam, but I will also tell that it would be highly useful for your examination of INICT. So I would recommend it that you should sure watch this sessions. So I think I am audible. Yes, I am audible. All the things are smooth, so we can start the session now. So before that, students and aspirants are also joining. I would like to tell you about the brief about the platform of Unacademy. So before that, about myself. So my name is Dr.Monalisa and I am the educator of anatomy subject on the Unacademy platform, and I am here to discuss the anatomy MCQs targeting image based cadaveric images MCQs, which will be highly beneficial for your competitive exam. So I have done my MD anatomy from Armed Forces Medical College and have got total of 8 to 9 years of teaching experience. Now, if we talk about the special class features which you can attend after downloading the Unacademy app, and if you are watching the session for the first time, you have to use this code ANAT10, which will help you as an unlock code. My dear aspirants, I would also like to tell you about the features of the special class. It's an interactive session where the learners and the educators can interact. Polls are conducted, raise your hands, get your doubts clear right itself when the session is going on. Never ever miss a session. So lecture PDF notes can be downloaded once the session is finished, anytime, anywhere. Read from the top educators of Unacademy platform. So these are the benefits which can be availed by you, and this is highly beneficial for you. So don't miss this golden opportunity, my dear aspirants. Okay. So never miss a session. That means if you start watching my session, you can follow me on the Unacademy app and you will get notification regarding all my session. So I would like to give you, this session is Cadaveric Image Session Part 1. So which is on Let's Crack NEET PG YouTube channel. But I would like to tell that my other sessions, that is the Cadaveric Image Session Part 2nd and 3rd, which is going to happen on Sunday 15 January. So this Cadaveric Image Part 2nd, 3rd, which I want everyone to join, because it will be highly beneficial and it is a connected series. So all of you join live for the 2nd and the 3rd session, which is going to happen on 15 Jan Sunday, and afternoon session is there, 2 session, 1 p.m. and 2 p.m. The interested students would use the code ANAT10 to unlock and be present live for the session. Okay, now I would also like to tell you about my today's session. So this is the session first. This will be followed by a 7 p.m. session, which is the session targeting for abdomen and pelvis MCQ. So I think this will be highly beneficial for you, abdomen and pelvis MCQ session 3rd part. So do join live, okay, for the 7 p.m. session. Okay, I would also like to tell about and give you information about the integrated session which is going to happen tomorrow 8 p.m. Saturday 8 p.m. So me and Dr. Dipti, so me explaining the skeletal muscle morphology and the anatomy, general anatomy aspect, and Dr. Dipti is explaining the physiological aspect related to the skeletal muscle. So I think this integrated session is highly beneficial. So do join me on the Unacademy Future Doctor. What is the name of the channel? Future Doctor. Okay, Unacademy Future Doctor channel, in which the session will be taken. The link of the session will be provided on Let's Crack NEET PG on the Telegram group, also in the Telegram group of Unacademy Future Doctors, also in the Telegram group of Unacademy. Now, plus subscription के बारे में बात करते हैं. It's covering entire 90 subject in a very systematic way. You can access both live and recorded version. You can study from the top educators of Unacademy platform. You can compete in live tests and quizzes. You can study on the device of your choice, and you can solve 25,000 MCQs made by the top educators of Unacademy platform of all 19 subject, clinical high yield MCQs of all 19 subject with a detailed explanation for each and every MCQs. So this can be also assessed by you. If you want to take the subscription, again you can use the code ANAT10 and get an extra discount of 10%. And with 1 year or more subscription, you are also provided with printed notes of plus subscription or plus course. Now, iconic subscription के बारे में बात करते हैं. When I am talking about iconic subscription, it's the merging of Unacademy and the Prep Ladder. That means you can access the best of the two platforms, Unacademy, prep ladder. Okay, so both can be assessed by you. Clinical integrated essentials, video lectures from the dream team, QBank 3, rapid revision snapshots, and treasure dream notes 2021. So my dear aspirants, all these benefits can be availed by you, and this is highly beneficial. So what I suggest, go for it. If you are preparing for INICT, NEET PG and next exam, go for prep ladder subscription. Benefit of two best platforms to target a better rank in the competitive exam, and also your university prof exam will be cleared by comprehensive courses on the Unacademy platform. So if you're going to take the subscription, you should require a pricing detail. So this is showing you the pricing detail of Plus and Iconic. Go through it and then decide which subscription you want. Use this code NAT10 and avail an opportunity of extra 10% discount. Now, study with me with the anatomy test series, which is going to happen on 21st January, 9 p.m. The students should present for this test. All the MCQs are made by me. So, I would suggest do join for it. Rank 1, 2 and 3rd will get exciting prizes and Amazon vouchers. Enroll by using the code NAT10. So, use this code NAT10, enroll for the test, and this will be highly beneficial. I would also like to suggest the students who want to join the pathology test series. This is highly beneficial. Again, this test series is today, 14 January, today 9 p.m. is the timing. So do join and get enrolled by using the code NAT10, and exciting prizes are waiting for you. Dr. Priyanka Sachdeva is taking all these MCQs are made by her. So do present live. I want to congratulate the toppers of December session 2021 FMG examination. So I just wish them that their examination, so I just want that their examination should be cleared. So all their examinations should be cleared. That is the NEET PG in the first attempt. This will be highly beneficial for you. So I want to congratulate the toppers. I also want to tell you about the updated highly effective QBank, which is containing more than 25,000 high-yield MCQs based on latest pattern of examination, includes a detailed description for each and every MCQs, and you can use the code NAT10 for extra discount and take the subscription. I would also like to tell about NEET PG 2022 MCQ. So I want to give you information which new batches are coming up. So target NEET PG 2022 batch MCQ discussion batch is there on the platform, taken by the top educators. So do enroll in this course. Also Focus FMG batch is there, so you can enroll in this course also. So these are all upcoming batches. So let's talk about the MCQ session now. So let's talk about the first MCQ related to the topic. Okay, so my dear aspirants, question number 1. All of the following are correctly labeled in the diagram except. So option A is dorsal interossei. So I will like to show you here. Okay, option A is dorsal interossei, option B is palmar interossei. Okay, and option C is abductor pollicis, option D is flexor pollicis longus, option E is hypothenar muscles, and option F is thenar muscles. So you can see this exactly the labeling here. So let me just focus here. Okay, so see here. So these are the labeling. So you have to mark the correct answer. So you have to definitely go for the correct answer. So your time starts now. Mark the correct answer, my dear aspirants. So go for it. Your time starts now. Okay. All of the following are correctly labeled in the diagram except. So we have got 6 options and you have to mark the correct answer. A, B, C, D, E, F. So we have got 6 options and you have to mark the correct answer. All of the following are correctly labeled in the diagram except. So Dr. Kaustup has given the answer C. C is not correctly matched. Okay, what about others? What about others? What about others? So I am waiting for them to answer and then I will come up with X. Actually, this is a transverse section. This is a cross section which is showing you the space. This is showing you the important muscles, tendons passing of the flexor and extensor group, and also muscles of hands. So you can just mark the correct answer. I got an answer from Dr. Kaustup. I am waiting for others to reply. Okay. So yes, actually the correct answer is exactly given by Dr. Kaustup and he is absolutely right. The correct answer is C. Okay, the correct answer is C, and here C is not abductor. So this muscle which has been asked, so actually this muscle which has been asked here, this is exactly not abductor pollicis, this will be adductor pollicis. This muscle is exactly adductor pollicis, not abductor pollicis. Okay, this is adductor pollicis muscle, not abductor pollicis muscle. So exactly we have got C as the correct answer, which is not correctly labeled. All other are absolutely correct labeling. Okay, so let me show you exactly the similar diagram here with the correct labeling. So actually this is a cut section which is showing you important structures. Okay, so you can see the metacarpals, and these are the dorsal view. So these muscles are the dorsal interossei muscle, and we know that dorsal interossei muscles are total in 4 in number. So these are dorsal interossei. Underlying to it we have got the palmar interossei muscle. So these are palmar interossei muscle. Now we can see the thenar and hypothenar muscle also, and we know that in the thenar space posterior aspect we have got so in the thenar space we have got exactly this muscle is the more specifically it will be the transverse head of the adductor pollicis muscle. So this is the adductor pollicis muscle, it can't be the abductor. Here thenar muscle, if you see the list of thenar muscle, these are the muscles which is abductor pollicis brevis, opponens pollicis, flexor pollicis brevis, abductor pollicis brevis, flexor pollicis brevis, and opponens pollicis. So these are together thenar muscles which is shown here, and close to it we have got the adductor pollicis muscle. On the medial aspect we have got hypothenar muscles. Okay, and close to in between the thenar muscles you can see also the another tendon which has been shown to you. This is the flexor pollicis longus tendon. So this is flexor pollicis longus tendon which has been shown to you. This is the cut transverse section which is showing you palmar interossei, dorsal interossei, hypothenar muscles, thenar muscles, and the correct labeling here is exactly here which has been shown. So you can compare this diagram with the diagram which is shown as in the MCQ, and we can see C is exactly adductor pollicis, my dear aspirant. It is not abductor, it is adductor pollicis. So C is adductor pollicis muscle. Okay, so yes, now let's move on to the next, that is question number 2. Nerve supply of the muscle shown in the image. So firstly you have to identify the muscle, nerve supply of the muscle shown in the image. So you identify this muscle, which muscle is this, and then you have to tell me what is the nerve supply of the muscle. Radial nerve, median nerve, thenar, ulnar, and posterior interosseous nerve. We have got 4 options, mark the correct answer. Nerve supply of the muscles shown in the image. Posterior interosseous, radial, median, ulnar nerve. So yes, Dr. Kaustubh, mark the correct answer. Your time starts now. Okay, so yes, radial nerve. So I got an answer from Dr. Kaustubh. What about others? Mark the correct answer. Is it brachioradialis? Okay. Okay, so I got an answer from Kaustubh. I am waiting for others. Otherwise, I will come up with the explanation. So let me just check. So yes, only Dr. Kaustubh has given the right answer, brachioradialis. Okay, your answer B is absolutely correct, dear Kaustubh, but it is not brachioradialis. So I will tell you it is not brachioradialis. Why? Which muscle is this? Anyone? Which muscle is this? See here, it is inserting at the second metacarpal It is inserting at the base of the second metacarpal bone. Okay, second metacarpal. So which muscle is this? It is inserting at second metacarpal, my dear. So which muscle is this? I have given you the hint. Originating from lateral supracondylar ridge of the humerus. Actually, yes, you can get confused by brachioradialis because both brachioradialis and extensor carpi radialis longus, both of it is originating from lateral supracondylar ridge, but insertion will give the difference. When we are talking about brachioradialis, it is inserting on to just proximal to radial stelloid process. Brachioradialis on the radial stelloid process. Radial stelloid process. Yes, now you have given absolutely correct answer. और यहाँ पे ये second metacarpal पे insert हो रहा है, then this is the extensor carpi radialis longus. See here, I have given the details of all this extensor carpi radialis longus muscle. Also, I have given you the detail. So here you can correctly see about this muscle. So see here, origin is from lateral supracondylar ridge. Insertion is onto the second metacarpal artery. So second metacarpal insertion, which is shown in the diagram. Arterial supply is radial artery. Nerve supply, which has been asked in the MCQ, is radial nerve, and the action is it is an extensor of the wrist, and along with extension of the wrist, it also causes abduction of the hand. Okay, so you can see here it is exactly extensor at the wrist, and along with extension it also causes abduction of the hand at the wrist. Antagonist muscle is flexor carpi unlaris muscle. Antagonist muscle is flexor carpi unlaris muscle. The antagonist of extensor carpi radialis longus is flexor carpi unlaris muscle. Okay, so let's move on to the third MCQ, that is question number 3. Most commonly involved artery in the thrombus formation. A, B, C, D, E, F. So that means you have to identify these arteries in this specimen. A, B, C, D, E, F. Okay, so 6 labelings are there. Identify and you just tell me which of the following artery is involved in the thrombus formation. So that means firstly you have to know which is basically most commonly involved in thrombus formation and leads to myocardial infarction. So if you are knowing that name of the artery, then you have to identify which is that artery in this heart specimen. So your time starts now. Mark the correct answer. Okay, lad, artery of widow. E. Kaustup has given the answer as E. What about others? What about others? Okay, question number 3. Mark the correct answer, my dear aspirants. Most common. Okay, so actually E is perfectly correct answer, and E artery is the correct answer. The reason why it is correct answer is this E artery which you are seeing, this artery which has been labeled here. Actually, this artery is the anterior interventricular artery, which is also called as anterior lad artery, left anterior descending artery. Okay, so actually the most commonly artery involved in the formation of thrombus is the lad artery, and we have got E as the LAD, lad artery, that is left anterior descending artery or anterior interventricular artery. So lad artery is involved in the thrombus formation in 50% of cases. Okay, so and the other arteries which is involved is right coronary artery, and right coronary artery is involved in thrombus formation is approximately, and we have got left circumflex artery. Left circumflex artery, we know that left circumflex artery is again the branch of our left coronary artery. The thrombus formation is seen in 15% of the cases. So here the most commonly artery involved in thrombus formation will be the lad artery, E, and E is absolutely correct, Dr. Kaustup. Let me show you this image. Okay, so here you can see in this diagram, you can see the left coronary artery. As we know, two important branches of left. One is winding. So one artery which is winding after giving Anterior aspirated vein, posteriorly this is the left circumflex artery, and the other artery which is descending down, and it is an important branch. As you can see, it's a very important branch of the left circumflex artery. This is anterior interventricular artery, which is also called as LAD artery. The other branches which has been shown is diagonal artery, the conal artery, branch of right coronary artery, also the right coronary artery which is shown, and this right coronary artery here, it is going to give another branch, that is the acute marginal. This is acute marginal artery. So all the labeling has been done, and we can see the correct answer is E, because LAD artery is most commonly artery which is involved for the thrombus formation and leading cause for the heart attack and myocardial infarction. Let's talk about the next question, number 4. All of the following structure opens in the marked hiatus, which is shown by the yellow color arrow in this image, except. All of the following structure opens in the marked hiatus except posterior ethmoidal sinus, middle ethmoidal sinus, maxillary sinus, frontal sinus. Your time starts now. All of the following structures opens in the marked hiatus except. I got an answer from Dr. Kaustuv. What about others? Okay, posterior ethmoidal sinus. So which sinus is this? Okay, A is the correct answer. Firstly, let me show you that 3 turbinates has been shown. In this diagram, we can see this is the superior turbinate, this is the middle turbinate, and this is the inferior turbinate. So very nicely we can see the 3 turbinate, and we know that just below the middle turbinate or the concha, we have got the middle meatus, and we have got, so here you can clearly see this is superior turbinate, this is middle turbinate, and this is inferior turbinate. That means the spaces which is residing below it. So that means the spaces which is residing. So this space will be the middle meatus, this space is middle meatus, this will be inferior meatus, and this will be superior meatus. So that means this space is, inferior meatus. This space is middle meatus. This arrow marked space will be middle meatus, and this will be superior meatus. So that means in this MCQ we have to know all the structures passing through middle meatus. We have to know. So this in this MCQ we have to clearly know, if this is the arrow, we have to clearly know all the structures passing through middle meatus. So my dear aspirants, posterior ethmoidal sinus opens into which meatus? So posterior ethmoidal air sinus is the correct answer. So you just tell me, posterior ethmoidal air sinus opens into which meatus? Which meatus? Dr. Kaustuv, posterior ethmoidal air sinus opens into which meatus? It opens into superior meatus. Superior meatus. Absolutely right. Absolutely right. Now see this image. So exactly we can see here the 3 turbinates. Superior, we can clearly see here the superior turbinate. We can clearly see the superior turbinate. We can see the middle turbinate. We can see the inferior turbinate. Okay, the 3 turbinates has seen, and the spaces which is residing below these turbinates are the respective meatus. So it is important that you should know all the openings in the meatus which is lying superior, inferior, middle meatus in the lateral wall of the nose. So there is a schematic diagram to make you understand. How to take first year anatomy classes live? How to? Okay, Priyanshu, okay, just a minute. Priyanshu, you want to attend first year anatomy classes live? Okay. So are you asking me to how? Yes. Okay, so you can attend that session on Unacademy Future Doctor, Unacademy Future doctor channel. Okay, so you can attend first year sessions in Unacademy Future Doctor channel, my dear. Okay, so and also on the also for being the part of first year, many special classes I take. So Unacademy special class may be Priyansu, you can be present for the live sessions of the first year students. So in between I always take, so difficult topics if you want, I can take on the special free sessions also. So you can just let me know. Okay, so yes, my dear aspirants, so let me show you this diagram where you can see the opening. So if we talk about the opening, so if I talk about the openings, my dear aspirants, so the opening in the middle meatus, which has been asked in the MCQ, we have got following openings. So in this middle meatus, we have got a elevation which is called as bulla ethmoidalis, and exactly on the bulla ethmoidalis, so see here, exactly on the bulla ethmoidalis, the structure which is opening is the middle ethmoidal sinus. So you can see here, this is the middle ethmoidal sinus. Below the bulla ethmoidalis, there is a shallow area, and this structure is called as hiatus semilunaris. Structure opening in hiatus semilunaris is maxillary air sinus, anterior ethmoidal air sinus, and frontal sinus. Now structures opening in the inferior meatus is nasolacrimal duct, only one structure. And why we have got posterior ethmoidal air sinus is the correct answer, because it is not opening in the middle meatus, but it is opening into the superior meatus. And in the most superior most part, you can see the opening of sphenoethmoidal recesses. In the sphenoethmoidal recesses, we have got sphenoidal air sinus opening. Okay, so done with this, all the openings of the lateral wall has been known. Let's move on to the next, that is question number 5th. Which of the following is strongest dorsiflexors of the foot? Which of the following is the strongest dorsiflexors of the foot? Which of the following is the strongest dorsiflexors of the foot? Question number 5th. Which of the following is the strongest dorsiflexor of the foot? A, B, C, D. So you have to identify the structure in this cadaveric image of the foot and lower anterior aspect of the leg, and you have to tell me the correct answer. Your time starts now. I will give you 30 seconds for marking the correct answer. Which of the following is the strongest dorsiflexors of the foot? Your time starts now, my dear aspirants. Please mark the correct answer. Dr. Kaustubh is telling B. Okay. Okay, what about others? What about others? What about others? So I got an answer from Dr. Kaustubh. What about others? Should I go with the explanation? Okay, so let me explain. My dear aspirants, the correct answer is C. The correct answer is C. So firstly, can I know which is the strongest dorsiflexor of the foot? Which muscle tendon, which muscle is the strongest dorsiflexor of the foot? Which muscle is the strongest dorsiflexor of the foot? The muscle is tibialis anterior. Tibialis anterior. The muscle is tibialis anterior. Okay, so we know that we have, so that means in this image we have to identify the tendon of tibialis anterior muscle. Okay, so यहाँ पे हमें tibialis anterior muscle का tendon identify करना है. The first thing is that if we talk about B, so Kaustubh, अगर हम B की बात करें तो this is the extensor retinaculum, my dear. This is extensor retinaculum. Okay, yes Dr. Kaustubh, you are right. Now यहाँ पे भी अगर आपको confusion tendon से हो रहा है, तो if you will see the tendon which is traversing below it, this tendon, and this tendon is continuing and it is going towards the great toe. So which muscle tendon is this? So this will give you the hint which muscle tendon it will be. This will be which muscle tendon? It is going towards the great toe. So कौन सा muscle tendon है ये? This is extensor hallucis longus. Okay, just adjacent to it towards the great toe, this tendon which you are seeing. So this tendon is TA, that is tibialis anterior. So we have got C as the correct answer. C as the correct answer. So यानी A, got it? Very good. So अभी यानी कि A कौन से muscle tendon है? Extensor hallucis longus. So here A is extensor hallucis longus. We have got C, which is the tibialis anterior muscle. Here C is tibialis anterior muscle. And if we talk about D, so D, which muscle tendon is D? It is very easy to identify. The tendons you can see together. Which muscle tendon? So which is D, dear? What is D? Extensor digitorum longus. And what about B? So actually B is extensor retaniculum, and if you are this is B is extensor retaniculum, and if you are confused with the tendon also, the tendon which is lying just underneath will be the tendon of extensor hallucis longus. So we have got C as the correct answer. So is it clear, Kaustubh? Is it clear to you? Okay, let me show the same image. So here you can see very nicely extensor retaniculum has been highlighted. This is extensor retaniculum, this whole retinaculum which is connecting the lower aspect as the tibia fibula, and tibialis anterior muscle. This is the tibialis anterior muscle which has been shown to you. Adjacent to it is the extensor hallucis longus muscle. Okay. This is extent, but your participation is very good and many of the answers you have given excellent answers and correct. Okay. So yes, and this is extensor digitorum. So this is extensor hallucis longus, extensor digitorum and extensor retinaculum. So the same thing which we have highlighted here is shown here. These are all structures passing underneath extensor retaniculum. So I just want to show you few schematic diagram to make you understand and revise the structures passing below extensor retaniculum of the foot and that of the flexor retaniculum. So see here, this is a schematic diagram in which you can see both the extensor retaniculum. So this is superior extensor retaniculum and this is I for inferior extensor retaniculum. So the structures passing as we move from medial to lateral. So as we move from medial to lateral, the structures traversing are, see here, the medial most structure is tibialis anterior. Then we have got extensor hallucis longus. Then we have got anterior tibial artery and that of deep peroneal nerve. Okay. Then we have got extensor digitorum longus and peroneus tertius. Then we have got ED, extensor digitorum longus and peroneus tertius. So that means the structures are tibialis anterior first structure, the second is extensor hallucis longus, anterior tibial artery, deep peroneal nerve, extensor digitorum longus and the peroneus tertius. So this is exactly the order of the structures which is passing below the superior and inferior extensor retaniculum. I would also like to show you a diagram which is showing the structures passing below flexor retaniculum. So this is the outline of the flexor retaniculum, okay, and the structures passing as we move from medial lateral, the structures passing is tibialis posterior tendon, then is the flexor digitorum longus, posterior tibial artery and the veins accompanying tibial nerve, and the other structure is the flexor hallucis longus. So these are all the structures passing below flexor retaniculum. These are all structures passing below flexor retaniculum. So is it clear? Let's move on to the next, that is question number 6th. Okay, let's move on to question number 6. So here what I want you to show is the diagram where, okay, see here. So my dear aspirants, यहाँ पे identify the marked structure. So can you see red color arrow and question mark I have put there. So you have to identify that structure, whether it is radial, ulnar, brachial artery or none of the above. So your time starts now, mark the correct answer. Identify the marked structure, whether it is radial artery, ulnar artery, brachial artery or none of the above. So I got an answer from Dr. Kaustubh. Let's move on with the other one. Yes, so radial artery is absolutely correct answer. The first thing is that you have to identify the medial and lateral. So actually my dear aspirants, इस image में अगर इस image की बात करें तो this is clearly the artery which you are seeing and it is dividing into two branches. So we already know that so this was the artery which has been marked. So here this was the question mark artery which we have to mark. Okay, so this is exactly the brachial artery my dear aspirants. So ये brachial artery है which can be identified. Why? We can see the texture and also we are seeing this artery is dividing into two branches. So firstly we have to identify the medial and lateral thing in this cubital region. So we are going to identify medial and lateral by seeing the muscle tendon and the artery. So यहाँ पे clearly एक muscle tendon दिख रही है. This is the biceps muscle and this is the biceps tendon. Okay, so this is biceps muscle tendon. Okay, so we know that biceps muscle के medially brachial artery lie करती है. So this is BA for brachial artery and this will be radial artery because it is lateral side and this will be ulnar artery because it is medial side. Okay, also you can see here the nerve. Okay, this is the nerve. So which nerve is this? This nerve is median nerve. And superficial structure which you are seeing, so superficial structure which you are seeing is the vein. So this is the roof structure and we know that we have got cephalic vein laterally and we have got basilic vein medially. Okay, so here this will be median cubital vein, this will be median cubital, this will be basilic vein and this will be the cephalic vein because it is lateral. So this is lateral aspect and this is the medial aspect. So absolutely correct answer has been given by Dr. Kaustubh. So yes, and also Aadhaar. So let's see this, the same diagram. Okay, the same diagram which has been shown to you. We have got medial and lateral. So we have got pronator teres muscle which is forming the medial. We have brachioradialis muscle. We have got the artery here which is dividing into two branches. Brachial artery, radial artery, ulnar artery. We have got median nerve. So I think this is giving you the correct picture. This is the median nerve and this muscle tendon which you are seeing here, this muscle, this is the biceps. This is the biceps muscle tendon. This is the biceps muscle tendon and the structures passing towards the roof structure is the vein. Median cubital vein, basilic vein and that of cephalic vein. So once again I am writing those things. So I think this will be clear to you. Is it okay? So my dear aspirant, is it clear to you? All these details, is it absolutely, this is which region? This is the cubital region. So everyone, is it clear? Can we move on to the next? Already both of you who has attempted this MCQ has given the right answer. So let's move on to the next. That is question number 6. Question number 6. Okay. Identify the marked structure. Can you see arrow marked structure here, my dear aspirants? Aadhaar, yeah. So identify the marked structure. Which muscle is this? Adductor brevis muscle, palmaris brevis, opponens pollicis, abductor digiti minimi. Which muscle is this? Identify the marked structure. Which muscle is this? Okay, I got an answer from Aadhaar, that is C. What about others? What about others? Which muscle tendon is this? Okay, so I got an answer from Aadhaar. I am waiting for the others to reply. Okay, so the correct answer is palmaris brevis. Actually, very superficial dissection has been done and you can see this is the superficial fascia. So this fascia which you are seeing here, this is the superficial fascia. Superficial fascia, and in this superficial fascia the muscle is content. So this muscle will be palmaris brevis. So that means palmaris brevis is so that means, yes Prerna Yadav, you are correct. So that means palmaris brevis is example of which type of muscle. So clearly you can see one side the skin is not dissected, here the skin is intact, and the other side superficial dissection has been done. We can clearly see the superficial fascia, and we can see that the muscle which is lying in the superficial fascia is palmaris brevis muscle. So that means this is an example of panniculus carnosus muscle. This is an example of panniculus carnosus muscle. Okay, so ये किस muscle का example हुआ? Panniculus carnosus muscle, the muscle which is contained in the superficial fascia. Panniculus adiposus means superficial fascia. Muscles lying in this is called panniculus carnosus. So we have got palmaris brevis muscle. अगर हम adductor brevis की बात करें तो adductor muscle, adductor brevis, adductor pollicis is basically the name that will be on the towards the thumb. Opponens pollicis will also be towards the thumb. Abductor digiti minimi will be on the medial aspect, but it will be on the deeper aspect. Okay, so my dear aspirants, I would like to show you few cadaveric images so that your concept of identification of thenar and hypothenar muscle is clear. So see here, this is the same thing which is labeled here. It is written PBM is the muscle. So PBM means palmaris brevis muscle. So let's palmaris brevis muscle, which is lying in the superficial fascia on the medial aspect. I would like to give you a brief, so you can see here it is merging with inserting into the palm. So let me give you the brief about palmaris brevis muscle. So palmaris brevis muscle, अगर palmaris brevis muscle की बात करते हैं, so it is getting origin from, it is originating from the flexor retiniculum medially and also from palmar aponeurosis, inserting into palm. So inserting into the skin of palm, arterial supply is palmar metacarpal artery. Nerve is superficial branch of ulnar nerve, and basically action is important. The action of this small muscle lying on the medial aspect, lying in the superficial fascia, is pulling the skin over the hypothenar eminence, which is formed by hypothenar muscle. Hypothenar muscle means abductor digiti minimi, abductor, flexor digiti minimi, opponens digiti minimi. So these will be deepening the cup of palm. So here the deepening of the cup of palm on the medial aspect, so that we can grasp the structures nicely. We can grasp any structure nicely and a proper grip is formed. So let's see the images. So here I want to show you this cadaveric image. If you highlight this diagram, if I am enlarging this diagram, as you can see here, so what you can see, the muscles on the thenar aspect and that of hypothenar aspect is clearly seen. So here what we can see, the medial most muscle of the hypothenar abscess, it is F flexor pollicis brevis. This slip of muscle which is on the lateral aspect is opponens pollicis, and the deeper aspect is the abductor pollicis brevis. Abductor pollicis brevis. So these three muscles. So these three muscles, that is flexor pollicis brevis, abductor pollicis brevis, opponens pollicis brevis, these are hypothenar muscles. Okay, now if we'll see the muscles on the thenar eminences, so we these are the muscles of thenar, these are the muscles of thenar eminence. Now I am moving on to the hypothenar. So sorry, slip of tongue. This is the muscles on the thenar aspect, thenar muscles. Now let's move on to the hypothenar eminence. So hypothenar eminences में abductor digiti minimi muscle is clearly seen. This is abductor digiti minimi muscle. Okay, this one, this is clearly seen, abductor digiti minimi. This is the underlying abductor digiti minimi muscle has been seen, and on to its medial aspect, the another muscle slip which you are seeing, this one, this is flexor digiti. This is flexor digiti minimi muscle. Digiti minimi muscle. Okay, so you must be wondering, abhi opponens digiti minimi kahan chala gaya? So opponens digiti minimi muscle, opponent's digiti minimi muscle, which is not shown. This is lying on digiti minimi muscle lying on the deeper aspect. Other than that, you can see the tendons of flexor digitorum superficialis, which is seen here. So you can see this is seen towards the medial phalanx, and one which is reaching the distal phalanx, which is reaching till the terminal or distal phalanx. This is the tendon of FDP, that is flexor digitorum profundus. Lumbrical muscles, flexor pollicis longus muscle. So all these labeling is showing you the muscles of the intrinsic muscles of the hand. So more diagram to make your concepts better cleared. So this is another cadaveric image where all the labeling has been done. So let me enlarge this diagram and explain you the important muscles. So see here, yahan pe firstly we have to identify the lateral and medial aspect. Okay. So here you can see this is the medial aspect. This is the medial aspect where the part of UN for the ulnar nerve, which is giving branch to palmaris brevis, palmar aponeurosis is there, abductor. So here the muscles, here the three muscles. So very nicely you can see nice dissected diagram. Here the three muscles of hypothenar eminences has been shown to you. These are muscles of hypothenar region and hypothenar muscle. These muscles, ODM means opponent's digiti minimi. Okay. Flexor digiti minimi and abductor digiti minimi. Other than that, here you can see flexor pollicis brevis and abductor pollicis brevis. So this is flexor pollicis brevis and we have got abductor pollicis brevis. So flexor pollicis brevis and abductor pollicis brevis are the muscles of thenar eminences. Now, so here the opponent's muscle is not shown because it is lying on the deeper aspect. Other than that, you can see the part of flexor retaniculum, FR, this is the flexor retaniculum. Also you can see the tendon of flexor carpi radialis, radial artery, and also you can see the tendons FCU, FDS. So basically we are concentrating. So here you can see the radial artery tendon, radial artery is shown to be nicely to you part. So basically we have seen the muscles of the intrinsic muscles of the hand in this diagram. Done with this? Okay. Now moving on to the next, that is question number 7th. All of the following structure passes through the arrow marked structure as shown in the diagram except. All of the following structures are passing through this yellow color arrow marked in this specimen. Mark the correct answer. Which opening is this? Okay, actually the correct answer will be superior epigastric vessels. The opening is, it is an esophageal opening or esophageal hiatus. It is an esophageal opening of the diaphragm. And we know that esophageal opening of the diaphragm is lying at the level of T10. So we have got three openings. This is one, this is the other, and this is the other one. So here we have got this at the level of T8 vena cava. This is T10, that is esophageal, and this is T12, that is the abdominal opening. So see here the same thing, schematic diagram. So actually the other esophageal branch of left gastric artery, anterior posterior vagal trunk, all these above structures is passing through the esophageal opening of the diaphragm, but superior epigastric vessel is passing through foramen of Morgagni in the diaphragm. So see here, foramen of Morgagni is the space which is located. So here you can see this is foramen of Morgagni, and foramen of Morgagni is the space which is located between the xiphoid and that of the costal opening, 7th costal cartilage and the xiphoid process of the sternum. उसके बीच में जो gap होता है उस opening को हम foramen Morgagni कहते हैं, and the structures traversing through foramen Morgagni is superior epigastric vessel branch of internal thoracic artery. Esophageal opening was asked in the MCQ, and the structures passing is esophagus, vagal trunk, both anterior posterior vagal trunk, esophageal branch of left gastric artery, and the tributary of left gastric vein. Minor apertures and openings through which the structures passing is greater, lesser, and least flanking nerve through the respective cruras of the diaphragm, azygous vein, hemiazygous vein. Aortic opening which is at the level of T12, and the important structures traversing is aorta, thoracic duct, azygous vein, and caval opening which is at the level of T8, and esophageal is at the level of T10, inferior vena cava and branch of right phrenic nerve. So I think your concepts are clear. Okay, crystal clear. So have great. So let's move on to the next, that is question number 8. All the best. Let's move on to question number 8. All the best, my dear aspirants. All of the following statement regarding the mark structure in the image is correct, except all of the following structure of mark. All of the following statement about mark structure in the image is correct, except. So A is upper head originates from lateral surface of lateral pterygoid plate. B is this muscle is inserting in articular disc and fibrous capsule of TM joint. Option C is superior head originates from infratemporal surface and infratemporal crest of greater wing depressor of the mandible. So which is the statement which is wrong about the muscle shown with an arrow marked here? So if you want, I will highlight this image. So can you see? Now you can take your time. You can identify this muscle. So see the muscle. You can identify now. Take your time. I will give you 30 seconds. Identify करो muscle को. By inserting points से आपको पता चल जाएगा which muscle is this. Now tell me which of the following statement is wrong about this muscle. Which of the following statement is wrong about this muscle? Your time starts now. Mark the correct answer. Question number 8. So my dear aspirant, the correct answer is upper head originating from lateral surface of lateral pterygoid plate is absolutely wrong, because it's not the upper head. So it's which muscle is this? Can anybody tell me this is which muscle? This is lateral pterygoid muscle. This is lateral pterygoid muscle. Okay. So yes, Pranav, I will come up with the explanation, don't worry. This is lateral pterygoid muscle, and we know that upper head of lateral pterygoid muscle originates from infratemporal crest of greater wing. Lower head originates from lateral pterygoid plate. Insertion is absolutely correct. It inserts into fibrous cavity, is correct. Superior head from the infratemporal crest of greater wing of sphenoid is correct, and it is only the depressor of the mandible. It is the muscle which is helping in opening of the mouth. So absolutely correct. B, C, D is a correct statement about lateral pterygoid muscle except the A one. So see here in this diagram you can clearly see, if I highlight this diagram, so let me mark the labeling. So here if I mark the labeling, this muscle which you are seeing here is LP, lateral pterygoid muscle, and you can see here this is the part of TM joint, and here this muscle is inserting into articular disc and the fibrous capsule of TM joint. So it is inserting on pterygoid fovea. So this was the muscle which has been asked. So this is the lateral pterygoid muscle which is inserting into articular disc of TM joint and also into the fibrous capsule of the TM joint and also into the pterygoid fovea. So just deeper aspect on this, you can see the muscle which is inserting. If you will see the outline, this is the outline of the mandible which has been shown. So this is the outline. So this is mandible bone. Okay, this is the mandible bone which you are seeing. ये मैंडिबल बोन है, ओके, ये मैंडिबल बोन है, सो ये एमपी हो गया, मीडियल टेरोगॉइड. ये जो कट सेक्शन का मसल है आउटर एस्पेक्ट, दिस इज द मसेटर मसल. दिस इज द मसेटर मसल ऑन आउटर एस्पेक्ट ऑफ द रैमस. सो दिस इज द मसेटर मसल ऑन द आउटर एस्पेक्ट ऑफ द रैमस ऑफ मैंडिबल. दिस इज द R for the ramus. This is R for the ramus of mandible. This muscle which you are seeing is the buccinator muscle. Okay, this is the buccinator muscle which you are seeing. This is the buccinator muscle. Other than that, you can also see the temporalis muscle, the fan-shaped temporalis muscle superiorly, which has been dissected out here. So you can see in this diagram, you can clearly see this is the temporalis muscle. So in this cadaveric image, you can clearly see the outline of the muscles of mastication. Very nicely, you can appreciate that. Now let's move on with further explanation. So I would like to show you another diagram where you can clearly appreciate the lateral pterygoid muscle and the medial pterygoid muscle, which is, so here you can see the lateral pterygoid muscle. Okay, so this is the lateral pterygoid muscle. So this will be the superior head of lateral pterygoid muscle. This is the superior head of LP, that is lateral pterygoid muscle. This muscle is inferior head of lateral pterygoid muscle. और लोअर हेड ऑफ लैटरल टेरेगॉइड मसल. सो यहाँ पे जो लोअर हेड है वो लैटरल टेरेगॉइड प्लेट LPP लैटरल टेरेगॉइड प्लेट से ऑरिजिन हो रहा है, इफ आई हाईलाइट दिस. ओके, बट द अपर हेड इज ऑरिजिनेटिंग फ्रॉम द ग्रेटर विंग ऑफ फ्रॉम द इंफ्राटेम्पोरल क्रेस्ट ऑफ द sphenoid bone. Same way you can see also the deep head of medial pterygoid and the superficial head of medial pterygoid muscle, as the ramus of the mandible has been dissected out, and inside you can see the deep head of medial pterygoid muscle and the superficial head of medial pterygoid muscle. So let's talk about the lateral pterygoid muscle first and then the medial pterygoid muscle. So if we talk about lateral pterygoid muscle, the lateral pterygoid muscle is originating superior head from infratemporal surface of sphenoid bone, lateral head from the lateral pterygoid plate, inserting superior head on the anterior aspect of the condyle and also in the TM joint, articular disc and fibrous capsule of the joint. Other than that, inferior head on the pterygoid fovea, and the nerve supply is mandibular nerve. All the muscles of mastication is getting innervation from mandibular nerve, and also the arterial supply is pterygoid branches of maxillary artery. Action depresses and protrudes the mandible and also required for side to side movement of the mandible. So in short, we got the detail of all the important statement about lateral pterygoid muscle. Let's talk about medial pterygoid muscle. So when we are talking about medial pterygoid muscle, the medial pterygoid muscle originates from deep head from the medial aspect of lateral pterygoid plate exactly behind the upper teeth, superficial head from the pyramidal process of palatine bone and from maxillary tuberosity. The insertion is onto the medial aspect of the medial angle of mandible in the inner aspect. This is important point. So medial pterygoid muscle is inserting on the inner aspect close to the ramus of mandible. Arterial supply is pterygoid branches of maxillary artery. Nerve supply is similar. Mandibular nerve to medial pterygoid. This is the muscle which is elevating the mandible and closes the jaw and also required for side to side movement of the mandible. Actually, both medial and lateral pterygoid muscle is responsible for side to side movement of mandible bone. So done with this, let's move on to the next, that is question number 9. All of the following statement is correct. All of the following are correctly labeled in this cadaveric image except A. Gluteus medius है, B. pyriformis है, C. sacrotuberous ligament, D. sciatic nerve. Question number 9th, mark the correct answer. So mark the correct answer, your time begins now. All of the following are correctly labeled in the image except So your time starts now, mark the correct answer. The correct answer is gluteus medius. Actually, this muscle which you are seeing A, this muscle which you are seeing gluteus, this is not gluteus medius, this muscle is gluteus minimus. Okay, actually this is the cut part of gluteus medius muscle. This is the cut part of gluteus medius muscle. And this muscle is gluteus maximus muscle. This is the cut part of gluteus maximus muscle. Gluteus medius muscle is lying on the quadrant, outer lateral quadrant of the gluteal region, and we have got clearly D as the sciatic nerve, which is clear. This is the nerve which is going down. So D is the sciatic nerve which is shown here, and we have got B as the, so clearly we have got this B muscle, P for the pyriformis muscle. And other than that, you can also appreciate in this diagram that this ligament which you are seeing is the sacrotuberous ligament. This is sacrotuberous ligament. So only A was wrongly labeled in this image. So same thing, let me show you. You can see A, B, C, D here. A is gluteus minimus muscle. B is pyriformis muscle. C is sacrotuberous ligament. Now, I would like to show you few schematic diagram to make you understand. So see here, why? So this bulky muscle which is overlying over the gluteal region, this is gluteus maximus muscle, but if you will see the outer quadrant laterally, this is overlapped by gluteus medius. So this is the site which is used for IM injection. So it is important that we go for IM injection in the lateral outer aspect of gluteal region, and that means we are inserting the injection in gluteus medius muscle, not maximus. And on the deeper plane, when you cut the gluteus medius, we have got gluteus minimus muscle. Here also you can see piriformis muscle, the key muscle of the gluteal region. This is the key muscle. Also you can see lower down sciatic nerve has been shown, pudendal nerve going towards the perineal region, and posterior femoral cutaneous nerve has been also visualized in this image. Okay, so let's move on to the next question, number 10th. Pathology of the given structure. So you have to just identify this image, that is the histological image. Pathology of the given structure will lead to which of the following speech disorder? Which of the following speech disorder? Okay. Visual agnosia, sensory aphasia, dysarthria, or verbal apraxia. Question number 10th. So firstly, identify this slide. If you want, I will show you the higher version or enlarged view. So this is exactly the histological slide, and you can clearly see which of this histological, you can get the structure by seeing this slide nicely, and then you tell me the disorder of that is which of the following. So which is the best answer here for question number 10? It was asked in AIMS entrance exam previous year. So firstly, tell me which histological slide is this? This is a slide of cerebellum. This is a slide of cerebellum, because we can clearly see the Purkinje cells. So see here, actually the correct answer is dysarthria, because we know that when cerebellum is involved, so what happens, ataxia is seen in the patient. So as the person's speech production requires coordinated and stimulation contraction of muscle group. Okay, so cerebellar disorder could disrupt the speech production, and there can be ataxia along with dysarthria. So all other options are with the functional area of the brain being involved, and we have to have a coordination of speech to be produced. So that is the case which is lost in the cerebellar region, cerebellum lesion. So we will go with dysarthria as the correct answer. The best thing to identify this is a slide of cerebellum can be done by seeing this image. So here, if you see this histological slide, this is the slide of cerebellum, and how you are going to identify, we can see the 3 layers or histological layers. So this is molecular layer, which is lying molecular layer. Actually, this is showing the cerebellum cortex. So this is the molecular layer. This is the Purkinje cells. These small cells which you are seeing here is the Purkinje flask sept. These single cells are Purkinje cells. These are all. So this is Purkinje cell layer. And the third layer or inner aspect, which is very densely populated, this is granular layer. So from outer aspect to inner, we have got molecular layer, we have got Purkinje cell layer, and we have got granular layer. So this is a slide of cerebellum. Okay, also enlarged view is showing you the Purkinje cell dendrites, molecular layer, and the Purkinje cell bodies, and underlying is the granular layer. So my dear aspirants, before ending the session, I would like to tell you the Conquer NEET PG 22 session, Cadaveric Image MCQs Session, which I have just covered, is the 3 PM session. One more session today I am taking, that is Abdomen and Pelvis MCQ Session Part 3, 7 PM today live on the Let's Crack YouTube channel. So do present live for this session. 7 PM में मेरा second session होगा आज Let's Crack NEET PG पे. Do present live for this session. I also want to give you information regarding my Sunday session. So I think this cadaveric image session was useful for you, and I want to continue the 2 more session on cadaveric images. My dear aspirants, मैं 2 more sessions लेना चाहती हूँ cadaveric image session पे. That is the session 2nd and 3rd, and the session will be taken at 1 PM and 2 PM on the Unacademy free platform. Unacademy free platform पे sessions देखने के लिए you have to download the Unacademy app. Then you have to find your goal as NEET PG. My link of the session of Sunday session, that is session 2nd and 3rd of cadaveric image continuation. Link will be provided on Let's Crack NEET PG, INICT Unacademy group and group. So that's via that link you can be present live. You can search also Dr.Monalisa special free session on Sunday, that is of 15th January. Okay, Sunday. So my dear, that is 16 January. Okay, that would be 16 January. So make a correction. That would be 16th January on Sunday, 1 p.m. and 2 p.m. Okay, 1 p.m. and 2 p.m. that would be 16th January, my dear aspirants. Okay, so I will also take a session Saturday. So on Saturday, I will take a session that is 15th January, 8 p.m. May, an integrated session about, this will be highly beneficial for first year MBBS students on the Future Doctor Unacademy. So Unacademy Future Doctor channel. This is on Unacademy Future Doctor channel. That is 8 p.m. integrated session with Dr. Dipti. Dr. Dipti will complete the physiological aspect and I will explain the morphological, structural aspect and the anatomy of the skeleton muscle. Study with me with the test series which is going to happen on 21st of January. So 21st January 9 p.m. is the timing. So do enroll. This is an anatomy test. Rank 1, 2 and 3 will get 5,000, 3,000 and 2,000 Amazon vouchers. So enroll in this test by using the code ANAT10. So use this code ANAT10 and enroll for this test. This will be highly beneficial for you and win exciting prizes. All the best, my dear aspirants. Also upgraded high effective QBanks, 25,000 more MCQs, clinical MCQs of 19 subjects. If you want to be the part of this session with the detailed explanation provided for getting a better rank, use the code ANAT10, take the subscription and get an extra discount of 10%. Comparison of NEET PG and Iconic subscription is there. Use the code ANAT10 and get an extra discount of 10%. So all the best. So before ending the session, I would like to tell you, so I will meet you 7 p.m. with the abdomen pelvis third part of MCQ session, and do like, subscribe, Let's Crack NEET PG platform. All the best. Keep studying. Thank you so much, my dear aspirants. Thanks, dear.